Hi, this is Stacy Williams, and I'm here to go over my SOAP note for this week. It's a cardiovascular patient. MS is a 61-year-old African American female who presented to the office today by herself. She is a reliable historian who is single and has health insurance. Chief complaint, patient states, I have been experiencing shortness of breath for the past 3 days. History of present illness. MS is a 61-year-old African American female who presented to the office today by herself with complaints of shortness of breath for the past 3 days. She states that she's been having shortness of breath when performing activities, walking up and down stairs, and at rest, and nothing has been able to relieve the symptoms for her. She states she has gotten worse in the past day and a half. She's been having swelling of bilateral ankles and feet, having difficulty breathing when laying flat to sleep, and has to use several pillows to elevate herself. The shortness of breath wakes her up every night. She reports palpitations when she is short of breath, but no chest pain. She has not gone to the ER, to the urgent care, nor has she seen a doctor since she's been feeling like this. Review of symptoms. Constitutional reports gaining 4 pounds in the past 2 days, denies any fatigue, chills, or fevers. HENT denies any issues. Cardiovascular reports palpitations at times when she is short of breath, but denies chest pain. Pulmonary reports shortness of breath at rest and with exertion, and coughing, especially at night. Neurological reports no headaches, dizziness, weakness, numbness, nausea, or vomiting. Hematologic and lymphatic denies any bleeding disorders or lymphadenopathy. Allergic and immunologic denies any drugs, seasonal, environmental, or occupational allergies, and denies any frequent illnesses. Past medical history, positive for congestive heart failure, hypertension. Preventive care, last saw the cardiologist June 12, 2019. She did have a physical and labs here last year, which were normal. Surgeries, denies any surgeries, denies any hospitalizations. Medication that she's currently on is metoprolol, 25 milligrams. She takes half tab daily for hypertension. Family history, no significant cardiac history. Social history, she is single and lives alone in an apartment. She doesn't watch her diet and eats out a lot, which she eats a lot of fast foods, canned foods, cold cuts. She works as a receptionist at a construction company. She does not exercise. She drinks 2 glasses of wine nightly with dinner and has about 1 bottle of water daily. She reports that she does not smoke or use any illicit drugs. Vital signs, heart rate is 120 today. Blood pressure is 100 over 60. Temperature 97.9, respirations 20, SpO2 98%, denies any pain. She's 5'2", she weighs 170 pounds, her BMI is 31.1, so she is obese. We did labs in the office today, and I'll discuss the labs later, what we drew. Her EKG was done today in the office, which shows a left ventricular hypertrophy. Physical exam. In general, she's an obese woman who is short of breath, at rest, but not in any acute distress at this time. HENT is negative for any abnormalities. Neck, no vein distension, no neck vein distension, and no bruits auscultated. Cardiovascular, tachycardic with a rhythmic heartbeat and has a S3 gallop that was auscultated. Bilateral lower extremities are positive with 3+ edema. No cyanosis or clubbing noted, and pulses are palpable and intact. Slow capillary refills noted. Respiratory, coughing but not productive. She has crackles and rales that were auscultated at the bilateral bases of her lungs. Abdomen is distended but non-tender. She does have hyperactive bowel sounds, which was auscultated ×4. Neurological, mental status intact. She appears a little anxious and frustrated, she states, due to the shortness of breath, but no sensory deficit noted. Differentials. Rule out congestive heart failure due to history, increased weight gain over a couple of days, shortness of breath, tachycardia, left ventricular hypertrophy on the EKG, and the pitting edema. Second differential is rule out pulmonary edema due to shortness of breath, tachycardia, and left ventricular hypertrophy. And the third differential is rule out pulmonary embolism due to the shortness of breath, coughing, and the tachycardia. The diagnosis we came up with today was the congestive heart failure. And what our plan is, the diagnostics that were done is we did the EKG, which we found out with the left ventricular hypertrophy. Also, we did a CBC to check the hemoglobin hematocrit levels. Thyroid levels were also ordered to check for hypo or hyperthyroidism, which can cause heart failure. We're checking the electrolyte levels to check for calcium, magnesium, potassium, and sodium levels, which affects the heart directly. BNP and pro-BNP were ordered because these are both elevated usually in congestive heart failure. BNP was ordered to assess for kidney damage because this can cause improper function of the muscles of the heart and other organs as well. Treatment, we prescribed Lasix 40 milligrams daily for 3 days, then 20 milligrams daily for 30 days. We gave 3 40 milligram tabs for the 3 days, no refills. And then for the 20 milligram tabs, we gave 30 with 1 refill. The Lasix is a diuretic, which is prescribed to relieve fluid retention. Then she's on metoprolol 25 milligrams, where she takes half a day. And we are upping that to 1 tab daily. So she'll be taking metoprolol 25 milligrams once a day. We gave her 30 and she has 3 refills. Metoprolol treats hypertension, heart failure, and palpitations. Education. So we want to make sure that she understands with congestive heart failure, you have to stay active. Obviously, today she needs to get rid of some of this fluid so she can breathe better. And so first we want to tell her to ensure that she's changing her diet. She has to restrict the salt in her diet, that's the sodium, no more than 2,000 milligrams per day. She needs to start hydrating at least 2 bottles a day right now since she has all this fluid. She's getting rid of the fluid, but we need to replace the fluid. We will think about ordering the potassium for her once we get the labs back. That was the discussion we had as well. We also want her to eat a heart healthy diet and replace the electrolytes. Stop eating the fast food, canned foods, and cold cuts. Incorporate more natural fruits and vegetables in her diet. If she can start exercising, that would be great. Aerobic exercises, even simple walks, starting 15 minutes a day, leading up to 30 minutes a day, 5 days a week, helps to improve cardiac health. She can also try to do the weight loss. Weight loss is a lot, 80% by what you put in your mouth, 20% what you do physically. So between changing her diet to a heart healthy, low sodium diet, and starting to exercise daily, that will help her lose some weight, which takes a lot of pressure off of her heart as well. We're also told her that she needs to weigh daily, using the same scale, wearing the same kind of clothes, or even naked before she gets in the shower in the morning, same time, and to record this every single morning, so that we know what her weight changes are. So we also explained that if she gains 2 to 3 pounds in a day, then that is fluid. If she gains 3 to 5 pounds in a week, that's fluid. So we need to be she has to be mindful of this. We instruct her to monitor her blood pressure and her pulse daily. We need to ensure that she's not becoming dehydrated. Her vitals showed a little dehydration today because her blood pressure was lower, her pulse was higher. So there is some fluid deficit, but we know that there's fluid deficit because she has the pitting edema, she's swelling up, and she has the fluid in the lungs. So we need to get rid of this fluid. We also asked her to follow up with her cardiologist as soon as possible so she can have some other testing done. We also prescribed an incentive spirometer. The incentive spirometer helps her to open up her lungs. When she pulls the air in, it opens up her lungs, and it actually pushes the fluid out so that she can breathe a little bit better. So she's told to do this as many times, every hour on the hour. The first 5 to 10 minutes, she needs to do this. And, until she can breathe a lot better, but to continuously have a routine with this. We did advise her, if she becomes more short of breath, to call 911 or go to the ER as soon as possible, and to also let us know when she gets a chance. Follow-up. We're following up with her in 2 weeks or sooner. As soon as the labs come back and any irregularities or any abnormalities, we're definitely going to call her. And that's about it. Please review. Let me know what changes I can make, how I can improve my soap note and get a perfect soap note. Thank you guys, and have a wonderful evening.